Diminished ovarian reserve is a term that's been used of late to describe patients that have a low quantity of eggs, and it's often correlated with age.
You want to think about ovarian reserves just like how much more gas you have, left in your car's, gas tank.
Many people with diminished ovarian reserve, they usually don't have symptoms.
So, what's important to understand is that patients that have diminished ovarian reserve, in general, are going to have elevated FSHs. So giving them fertility medication is not effective. We can artificially suppress the FSH level that, especially in women that are under 45, may allow a follicle or two to start to develop.
Recently we had a patient from UK. She was 40 years old. Her FSH level was varied between 20 to 24. Her AMH level was 0.01. So her doctor in UK would suggest her using donor egg. And we finished 3 natural cycle IVF for this patient. And we actually get 3 eggs, made 3 embryos, and 2 of the 3 embryos passed PGS test. And the first embryo transfer results pregnancy.
That's a perfect example of how the genetics of the embryo, the quality of the egg, and how it performs really doesn't correlate to her diagnosis of diminished ovarian reserve.
So for those patients, you have no way to grow in 3 follicles. It's 1 follicle, that's it. So I think with natural IVF, that certainly gives this patient a chance.
In our setting, people are able to do multiple cycles and they don't need to spend so much money to try to stimulate the ovary, which eventually do not respond. So it actually makes trying to have their own oocyte generate embryos make a much more reasonable alternative.
It's really seizing the opportunity when you have the highest chance of being successful with your own eggs and knowing that you can do that without breaking the bank.
The diminished ovarian reserve is a very common medical condition. That for those women has been strongly encouraged by a doctor to do a donor egg retrieval because of you have a diminished ovarian reserve. Please give a second thought. And if you have a chance to call us, and we have be happy to give you a consultation and review your system and review your condition to see if we can help you to achieve pregnancy with your own eggs.